Go.
You're responding to a parking garage for a possible assault victim. Police are on the scene when you arrive and you're waving over towards them. They are standing over your patient who is lying prone on the ground with a small puddle of blood around his head. You do not notice any spontaneous movement from the patient as you approach. An officer has secured a tire iron approximately 10 feet away from the patient.
Okay. PVE, it seems safe.
Scene is safe.
I'm going to request ALS. PD on scene.
You don't think.
All right. So, going to go ahead, do the consideration for spinal stabilization, and it is needed. I'm going to go ahead and slap the C collar on right there. How do I do that? What else is there? Shoot. Sir? Hey, sir, can you hear me, sir? Sir?
Respond to painful stimuli.
All right. Checking pulse. As I listen, with the screaming, did the airway sound clear with his moans of pain?
The airway is open. Patient 3 front teeth have been knocked out.
But they're not in the airway?
They're not there in the airway.
Okay. And what about, I'm going to check pulse and chest rise and fall.
Okay. Radial pulse is rapid and weak bilaterally.
The breaths are weak bilaterally?
Radial pulse is rapid and weak bilaterally.
What about the breaths?
The airway is open and patent 3 front teeth have been knocked out.
There's nothing about breaths? No respiratory rate? No anything? All right. That's weird.
Wait, calm down. 26 breaths per minute with an irregular pattern.
Regular pattern? All right, we're just going to go ahead, BV them back. So, is there a gag reflex present?
No gag reflex present.
All right, we're going to throw OPA in him. So, all right, we're going to bag him. We're going to throw him on 15 liters per minute, high flow oxygen.
Okay.
All right, now that we got that out of the way, let's go ahead and move on to our full head to toe assessment. I'm taking out the head. Any DCAT?
Bleeding from laceration on the back of the head.
All right, is there any depression or anything like that, like skull fracture? All right, we're gonna go ahead and wrap him up, take care of that. Also go ahead and, we have the C color on by now. What about eyes?
Let's go back to the head. Possible skull fracture on the left side, blood and CSF draining from the left ear.
Yeah, go ahead and put a bird in the air. Question for immediate care flight. All right, how about eyes?
No battle signs or recognized.
The pearl? Nose?
Oh, it still says zero.
Nose.
It says possible skull fracture.
All right. JVD, tracheal, yes.
No JVD or tracheal shield.
All right. Moving over to chest. I'm going to palpate. Got anything?
No injury noted.
All right. Moving Pelvis.
Stable pelvis,
All right. Left lower leg.
nothing there,
Right lower leg.
nothing there,
Pulse. PMS.
are present,
Left arm.
nothing there,
PMS.
pulse is present,
Right arm.
pulse is present,
PMS. All right. So, gonna go ahead and have them cordon off landing zone for the helicopter. If we need to beat them, we're gonna go ahead and this is high priority, lock and load. We're gonna put them in an ambulance and wait to hear from care flight or life flight, whatever the bird. If we need to meet them, we'll meet them. Go ahead and now we have them in the ambulance. Let's get some vitals on. So pulse.
186, 58 beats per minute.
58 beats per minute. Let's talk about blood pressure.
186 over 118.
SpO2.
94%.
We're manually ventilating, so it's not a issue about rate. All right. We're gonna go ahead and throw them in the Trium Volt feet up position. So head down. All right. So we're gonna recess for every 5 minutes. How far out is care flight? Make it up, Hutch.
5 minutes.
5 minutes? All right. So we'll reassess one more time. Our vitals about the same. All right. So here's care flight. Here's my field pressure. How old is this guy again? Does it say?
He is 35.
35? All right. So we have a 35-year-old man who is responsive to painful stimuli. There is a depressed skull fracture and laceration on the skull. His heart rate is low. His BP is high. We have manual ventilation. He is stabilized. Done.